So obviously nurses can work in a hospital setting. We also utilize nurses in ReVision's Ambulatory Surgery Center, and the settings are quite different. The hospital does tend to be larger and a little bit more sterile. At ReVision, eye surgery is a big deal, but the patients aren't acutely ill. So the physical setting's different. At ReVision, it's warmer. It's a state-of-the-art facility, yet it's also inviting and comfortable. The work setting is also quite different. It's pretty lighthearted. Patients are really excited before surgery, maybe a little nervous after surgery. They're very excited about their new vision that they're going to have. And with some surgeries, you see that result right away. So it's cool to share in that experience. It's just pretty positive and lighthearted and quite different from a hospital setting.
I've worked in the hospital before, and it is an opportunity all its own. But in ambulatory surgery, you play a role not only in patient care and the day-to-day on the floor, but you also participate in the administration and the running of the facility. You're much more involved in not just the executing of policy, but the creation of policy. In the hospital, you have so many coworkers. You don't necessarily work with the same people every day or even on a consistent basis. In an ambulatory surgery setting, you have the same people that you're working with. You are building close relationships with the doctors, with the administration, with leadership, and because of that, you have an increased level of independence, and your participation is not just on the ground floor, it goes all the way up.
Nursing here at ReVision is, it's pretty streamlined. First of all, we're only working with healthy people. If somebody's sick, they're not having eye surgery. And so that's a big bonus. We do not work holidays. We do not work weekends. Our emergencies are almost nil. So we have pretty set hours.
The role of a nurse at an ambulatory eye surgery center is in broad categories: preoperative care and postoperative care. Preoperatively, they'll meet and greet the patient. They prep the eye and help sterilize the eye. They'll do some markings on the eye, occasionally with certain procedures, start an IV, review medications, and make sure they're all prepped and ready to go for the surgery. And also they start numbing drops for a painless procedure as well. In the postoperative area, the patients are a little groggy because they've received anesthesia in the operating room, so the nurses make sure the patients are waking up well from that. They'll check the vitals, go over very important postoperative instructions and or limitations, and again, just make it personal.
So a typical day at ReVision for me looks like getting there a little bit earlier so that we can have everything set up and ready for patients when they begin to arrive. Our LASIK patients are typically of the younger generation. They're young, they're healthy, they haven't had many encounters with surgery. Many of them have been in glasses since they were in elementary school and very young. So they come in, this is their first real brush with a serious healthcare setting, and they are extremely nervous, but they're also excited. And our cataract patients are typically on the older end of the age range. They are familiar with surgery and with healthcare. This is by no means, many of them, this is not their first surgery. It's fast-paced, but it's exciting, it's fun. It is a very exciting opportunity to work with people who are not necessarily acutely ill, but they do need some help, and you're providing them with a gift that they receive every day when they wake up for the rest of their lives.
The nurse in the pre- and postoperative area are in direct communication with the surgeon. They give us updates on how the patient is feeling before the procedure. They cue us into specific questions the patient might have, so we know how to have that conversation with them and what really is top of mind for them.
Working at ReVision, you spend a lot of time working side by side with the surgeons, which has been very educational for me. I have a very curious mind. I obviously focus more on starting IVs and eye drops and getting people ready for surgery, but I want to have a better understanding of what happens when they go into the OR, and our surgeons are excellent teachers, and I find that I learn new things all the time. They are very welcoming for you to come to them with questions, teach you what it is that they do, help you put the pieces together so that you can have a better knowledge base, so that when you are applying that to patient care, they trust that they are getting the best care possible and that every member of the team understands the process and is able to guide them through it successfully. I think ReVision has worked really hard to create a positive atmosphere and an uplifting work culture. Working with the team is something that I'm grateful for all the time. I come into work feeling very happy to be here.